So what are the most important developments in migraine prevention in the last year? Well, in the last year we've had three exciting new molecules, which are the monoclonal antibodies against CGRP or its receptor. And they've been very valuable for many patients to control both episodic and chronic migraine. And then there's also been the vagus nerve stimulator, the gamma core, which we're now using for migraine prevention. A Chiari malformation headache is caused by a Chiari malformation, which is a lowering of the bottom part of the cerebellum into the spinal canal. And the headache characteristic is the cough headache. So people who have a cough and an explosive headache, usually creeping up the back, are possibly having this caused by a Chiari malformation. There may also be symptoms around the face, lips, mouth, having to do with swallowing. And sometimes people who have a spinal fluid leak can have a Chiari malformation or something that looks like it and can have similar symptoms. But the treatment is different if it's caused by a spinal fluid leak. There's a little bit of a rather poor quality evidence around that, and then there's experience. Personally, I've been a little bit disappointed with how well my patients have done with the cannabinoids. I think some of them have had some relief, and many have had more relief for other associated symptoms, for sleep, for other pain, and it's been helpful for them managing their overall life, a little less so for the headache problem. I have greatly enjoyed my roles in advocacy. I was first vice president, then president, and now past president of the Alliance for Headache Disorders Advocacy. We've made a lot of strides in changing policies for patients with migraine who are stigmatized and discriminated against, and there's a huge amount of work to be done, further addressing these policy shortfalls as it applies to people with migraine. And as far as miles for migraine, I've seen it grow from 2 races to this year we'll have 19 walk runs, we'll have 5 education days, we will have patient support groups, we'll have adolescent camps around the country. It's very exciting, and it's kind of the birth of the advocacy movement in the United States. To me, if we accept this is low-hanging fruit. I think that the patients in the United States, the Coalition for Headache and Migraine Patients, have kind of chosen a lexicon that they would prefer that people use when possible. And some of the changes are very simple. So don't say migraines, say migraine. It's a disease. You don't say asthmas. You say you have asthma with a superimposed asthma attack. Don't say migraine headache. Migraine is a lot more than a headache. Just say migraine. And don't say migraineur. You wouldn't say epileptic. You say person with migraine. So a few simple choices in your words can make a difference and can help to get migraine the recognition and patients the respect of a disease that is not their fault.